with this modification will create the keratoconus, subacute chronic keratoconjunctivitis. Okay, so and the symptoms are very common to any infectious sickness: foreign body, red eyes, burn eyes. This I think is a simple but very clear approach to the understanding of the biomechanical modification that will occur to the cornea already affected, infected by the parasite. Also the fact that it's before one eye and after the fellow eye, not always in a close distance, but sometimes in 1, 2 years, 3 years distance, can explain more logically what is not genetic. Because genetic, I don't see why you should not start in both the eyes at the same time. Also this is clear for you? Es ist klar? Verstande? Yes, okay. So, now that we know this, we go to the biomechanics of the keratoconus. So we already know of the Hornhaupt, we already know of the collagen fiber, we already know of the pressure. So if you add to this factor that they work with function time function, okay? But time function can vary on circumstances like a more weak person, an infection more aggressive, environmental condition worsen, or a person that use rubbing the eyes, stretching the eyes, and the use of the contact lenses will explain why the speed of growth of the pathology can change by case to case. I forgot to tell you one very important fact on genetic. A genetic normally, an alteration of a gene is found not only in one member of a family. It is known that a genetic disease must affect more than one member in one family. In fact, we have families with a certain number of keratoconus cases recognized as keratoconus, and family in which is only one keratoconus. You can go up and down, large and long, no brother, no sister, no uncle, no grandfather, grandmother, no nephew, only one member. So we come back to the very unlogic and anti-statistically approach that a genetic sickness can catch only one member in a whole family. So that is a genetically unlucky member. So, going back to the biomechanic, if you put a corneal lens on an affected cornea, you provoke these physical facts. First of all, the lens, to stay on the cornea, must stay on the cornea only because of a negative pressure between the lens and the eye. In the vector that represents the negative pressure is in physics a vector that has the same direction, obviously much less strength, of the intraocular pressure vector that push outwards. Questa è fisica.
Das ist Physik, also Physik, no?
So the story of the hand that is there, you know, this very nice hand that is the contact lens that will push the keratoconus against, on the contrary, is an incredible scientific lie. So the other second problem is the oxygen support of the cornea. A normal eye needs 70% of the oxygen from the atmosphere. 30% is given by inside fluid of the eyes. So, a healthy eye has been conceived to get 70% of oxygen from the atmosphere. How much oxygen need in an healthy sick eye? I think more. Normally, to a patient, they give oxygen, okay? So it means that maybe we should need more oxygen. So, on the contrary, any contact lens, soft, hard, no one contact lens can carry the oxygen on the surface of the cornea for a very simple reason, because it's an artificial substance. No artificial substance can carry oxygen on the surface of the cornea. You can have the permeability, and the industry very cleverly say maximum permeability to the oxygen. But you must not be confused from the meaning of permeability from the meaning of carrying oxygen on the surface. The only way in a lens, if a lens is made by Gore-Tex, for example, we know that Gore-Tex, you have traces of Gore-Tex and you don't sweat. Why? Because we move. So we act pumping the air through the Gore-Tex. Now, the problem with the contact lens that is done with material similar to Gore-Tex, that you can have a permeability to the oxygen, but you must decide to drive your motorbike 40-60 km per hour with open eyes and without any glass in front of you. Then you will have a permeability to the oxygen. Then the pressure will be enough. Or you buy a small house compressor and you can refill the oxygen to the lenses. I'm sorry, I know that some colleague will deny and possibly but you cannot go in this direction. The very kind people here of the two industry of the contact lenses will not agree, but I will want to listen scientific method this is very important. Like the one I taught now to deny what I said. Now, the importance of the oxygen is fundamental to understand that our inner layer, that is the endothelial cells layer, the life of these cells depend from the quantity of oxygen, mostly depend from the quantity of oxygen the cell can breathe. So, in the life, this tissue is defined perenne. Perenne? Perenne? Perenne.
Evi. È sempre vuol dire.
Sì, perenne che... Perenne, perenne. Okay.
Evi. Evi.
Heavy?
Yeah, imma.
Für immer.
Continuity.
What does it mean, für immer? It means that you born with this tissue an exact number of cells, approximately 3,600, 4,000 for square centimeter, and this cell must be enough till you are dead. Nobody will replace these cells. So this is our precious treasure. We must look very carefully to the endothelium. That's the reason why the transplanting surgeon are trying to pass from the total transplant to the lamellar transplant. Obviously, this is a much more wise solution than the total transplant. So, anything that can affect the endothelial cell, in fact, is affecting our durability of transparency of our cornea in our life. Because you must know that this endothelium, in fact, is the one that gives nourishment to all the cornea. So from the lower layer to the upper layer, they are fed by the endothelial cell, transportation, nourishment, and so on. So for this serial reason, many years ago, I started to think to something that could change the shape of the cornea without changing the cornea and trying to avoid as much as possible deficiency of oxygen on the cornea.